And we're rolling.
Okay, so today I'm going to teach you how to give subcu fluids to our kitty Rags. We're going to start by hooking up the IV bag with an IV line. So what you want to do is pull the end off of the bag, giving you access. And then you want to pull the cap off of the end of the IV line so that you can insert the spike into the bag. You want to make sure it goes in straight so it doesn't puncture the side of the bag. And once you get it in, then you will want to use the roller on the line to close this so you can hang the bag without the fluids leaking. Now we want to prime the line so that there's fluid in the whole line. I like to squeeze the chamber until it's about half full with fluids. And I will take the end off the line and roll my ball up to unlock the line so the fluids can flow. Once the fluids are coming out, then I close the line off again. And I'll put the cap back on. Now we're going to attach the needle to the bed or to the end of the line. You just pop the needle out and you just screw it on the end of the line so it doesn't fall off. So now we're going to actually give the fluids to Rags. When we do this, we want to lift up on the skin right behind the neck to kind of make a tent. And that's the area that we're going to want to insert the needle. We want to do it at about a 45-degree angle. So we also want to put the needle in with the bevel side up, and that would be so that you can see the hole on the end of the needle. So we're going to lift up and make a little tent, and we're going to insert the needle right into the skin at a 45-degree angle. Once it's in, you can go ahead and move the roller ball up so that your fluids are flowing. And you'll see that your fluids are flowing because you can see them flowing from the top of the chamber into the middle of the chamber where you've got your fluids. I'm going to turn this off and I'm going to show you on the bag there are marks. Every mark between 1 and 2, this is 50 mils. So this is 50, and then so the 1 to 2 is 100 mils. And often we'll have you give somewhere between 100 and 200 mils to a kitty. So if somebody asks you to give 200 mils, and you started at the 1, you want to go all the way down to the 3. And when you're done, after your fluids have flowed in, you just pull your needle straight out after you've shut it off, of course. And you can just put the cap right back on. And that's how to give subcu fluids.